My name is Cammie Chapman. I am the Associate General Counsel of the Office of General Counsel for the Department of Health and Human Resources assigned to the Bureau for Children and Families. And this is Barno, and I'll let her introduce herself.
Hello, I'm Laura Barno, and I'm the Director for Children and Adult Services at the Bureau for Children and Families.
And Laura and I have been traveling around the state doing presentations on Family First. So this is a little bit of a longer presentation than if you've seen some of our other ones, but we're somewhat known for our Family First presentation these last few months. In February, almost a year ago, the federal government passed the Federal Bipartisan Budget Act. And I'm sure that's not a big day in your life, but what it turns out to be is that buried within that budget was the Family Prevention Services Act. And lo and behold, when we started reading it, we realized that it changes the way we do business in foster care. It's a concept that we talked about and we make findings about, but we didn't have the reinforcement from the federal government in terms of federal dollars to do much about. So, as you all know, many of you know, Title 40 provides reimbursement to the state for children that have been removed from their families. And we only do that in cases where reasonable efforts have been made to maintain that child in the home, and we use the least restrictive alternative to the home. And those are all findings that we're familiar with, that we see in orders every day. Now, the federal government, this will begin October 1st, 2019, and we're going to get into the weeds about this. But now, we will actually be able to get reimbursement for prevention services. So, we can use the prevention services that Laura will go into a lot more detail about, but we can use those services in order to keep the child in the home so we never have to remove the child from the home. And that's the essence of Family First. But it's more than that. And I've been going to national conferences talking about Family First, and Jerry Milner, I've become a total groupie of Jerry Milner. I've drank his Kool-Aid. I really believe what he's telling us, and he is the acting commissioner of the Administration for Children and Families. And he read a poem, and I'm not the best reader when it comes to dramatic reading, but he read this poem that I thought really highlights sort of how we've been dealing with foster families and foster children for a long time. So, here we go. Here's the poem. 'Twas a dangerous cliff, as they freely confessed, though to walk near its crest was so pleasant. But over its terrible edge there had slipped a duke and full many a peasant. So the people said something would have to be done, but their projects did not at all tally. Some said put a fence around the edge of the cliff, some an ambulance down in the valley. But the cry for the ambulance carried the day, for it spread through the neighboring city. A fence may be useful or not, it is true, but each heart became moved with pity for those who slipped over that dangerous cliff. And the dwellers on the highway and the alley gave pound and gave pence, not to put up a fence, but an ambulance down in the valley. Then an old sage remarked, "It's a marvel to me that people give far more attention to repairing the results than to stopping the cause, when they be much better aimed at prevention. Let us stop at its source all this hurt," he cried. "Come, neighbors and friends, let us rally. If the cliff we will fence, we might almost dispense with the ambulance down in the valley." So that's the essence of Family First. Now, I'll be the first to admit, reimbursement-wise, doesn't fit with this, but it is a step in the direction of putting up that fence in order to prevent our folks from falling over it. So anytime we can do anything that serves people upstream, and the more we can do to put CPS out of business, the better off I think we will collectively agree. But it's not magical. We're not going to click our heels and say, poof, we now have a prevention service system in each and every one of our 55 counties where we do in-home, community-based services perfectly, every time. It's a process, and the federal government has provided that for us to create a 5-year plan. It doesn't even start until October 1st, 2019, but that's rapidly approaching. Trust me, we realize how close that is. But this is a process. So don't get frustrated with the department, that I know you already are, but don't get frustrated with the department when every service isn't in your community on October 2nd. It won't be. We're working on this, and not only are we doing it with the child protective services and the youth services, we're also thinking about it in a broader sense. So outside of the world of Bureau and Children and Families, we're thinking about having, how can we have mobile crisis centers so that you can call a 1-800 number 24/7 and deal with youth crises that are having mental health crises at that point, instead of waiting until the petition is filed. So our cabinet secretary has taken the words of Jerry Milner and drank the Kool-Aid, and we are exploring every avenue we can think of to help people further upstream and so that they never hit the CPS youth services court system. But today, we're going to get down in the weeds as to the mechanics of Family First and what we'll be doing with prevention services, and then there's also a new categorization of residential child placements. Yeah,
I can't hold the projector and talk at the same time, so Cammie's going to do a service for me. Okay, let's get down into the weeds about the prevention portions of Family First. Family First allows for 3 categories of service provision that will be reimbursed for Title IV. Those are mental health, substance abuse, treatment services, and in-home parenting education. There's a 12-month provision that comes with this, but there's no limit on the number of 12-month periods that a family can have access to those prevention services. So for example, if a family has been identified and has been offered these services, and then the case is closed, everything's fine, but then in 5 years, there's another crisis in the home and they have to have another open case, they can have another year worth of prevention services. So there is no limit on the number that a family can have. Now these, Cammie mentioned about how Family First is a fabulous first step for us to start looking at serving children without taking them into foster care, but it is a first step. So one of the things that have to be established for children and families who receive these services is that they have to be considered a foster care candidate. And a foster care candidate cannot be a foster child. These are children who are at imminent risk of removal. And that is a definition that the feds really haven't given us with an imminent risk of removal, so states are kind of defining that for themselves. In West Virginia, it's likely going to be kids who are in open CPS or open youth services cases with a case plan and a safety plan. And so children who are at imminent risk of removal are a foster care candidate, and children for whom an adoption or a guardianship have already occurred. So the kids who have been adopted through the child welfare system or who have a guardianship case, a legal guardianship, these children can access the prevention services in order to prevent disruption of the adoption or the guardianship placement. Also, children who are in foster care, who are pregnant or parenting, and the caregivers of all these children. Do I go into detail? I don't. So let me tell you a little bit about the pregnant and parenting. These have to be foster children who are either have small children or who are pregnant. And so these services are aimed at helping this teen, they're generally teenagers, become a parent for that new life. So the services that would be provided would be to make that teenager a better parent and to prevent that baby or toddler from coming into foster care. There's a catch. These are not just dollars that states can use for any in-home or any mental health or treatment services. They have to be evidence-based. And so the federal government, through the Family First Prevention Services Act, has set up 3 types of evidentiary criteria. There's the well-supported, the supported, and the promising. And each of those have a pretty detailed, which we won't go into today, pretty detailed scientific or quasi-experimental categorization that they have to follow. There were 12 services the federal government released, November 30th, that program instruction came out? And let me just make a little caveat here, is that the program instructions have come out painfully slow related to especially these prevention services. And they're not all out yet, which I'll talk about in a minute. But the federal government has identified 12 services that they're going to review. Because what happened with Family First is that they set up this evidentiary criteria that no other clearinghouse in the country uses. The closest thing that we have for an evidence-based clearinghouse for services is the California Clearinghouse. But the California Clearinghouse doesn't use this three category evidentiary standard. And so what the federal government has to do is they have to study all evidence-based services that might be used for Title IV and individually categorize them. So this is an explanation of why this process has gone so slowly. And as Cammie mentioned earlier, we do have to submit a 5-year plan to the federal government to detail which services we are going to embrace, which treatment, which in-home, and which mental health services we're going to embrace. And they all must be delivered under a trauma-informed approach. Here are the 12 services. As you can see, there are several mental health, several substance abuse, some overlap, are considered mental health and substance abuse, like motivational interviewing. And there are some services on here which are already offered in West Virginia. We have trauma-focused cognitive behavioral therapy. And some of you may know, are familiar with the functional family therapy, which is a service that was born from the Senate Bill 393 from 2015, that we have in small pockets. The Healthy Families America and the Parents as Teachers, those are currently available in West Virginia. You see those on our prevention. Those are what are considered primary prevention services. And so these are services that serve babies, newborns to up to 3, maybe 5 years old. So these services are now going to be open more for availability to Child Protective Services cases. So what will happen with the ones that we already have in our state is that we will hope to see those expand into other communities. The Parents as Teachers program we have, it's an evidence-based. It's already offered through what's considered our McV, which some of you may be familiar with that funding stream that we've been getting, that our public health and our early child care divisions have already been administering for years. So those are wonderful programs that we should see expanding. And the Kinship Navigator programs, I'm not sure if all of you are aware, but West Virginia applied for and was successful in obtaining a grant from the federal government to help, and it's not a lot of money, so it's going to help fund a pilot to provide supports in the regions to relative kin providers who are trying to navigate the Child Protective Services or the Youth Services system. And this will aid or just ask questions, help them, receive funding and financial assistance. And so it'll just kind of provide a support system for them when they take on their relative children. Oh, yes, thank you, Cammie. This is only the first 12 services. We receive, as I said earlier, like little tiny bits of information as the federal government tries to put their arms around this too, because that was a very ambitious time frame for states to absorb and then for the federal government to interpret a lot of the language. But the intention is for the Administration for Children and Families to maintain a clearinghouse, and they will continually be adding services. These first 12 are the ones that they're going to review. They do plan to provide further feedback about these 12 services in the spring. They're going to tell us, number one, which evidentiary standard that they're going to rate under. And so at that time, states can start to navigate how they're going to develop their prevention plans. Because part of a requirement of Family First is that at least 50% of the services that we utilize have to be in that top echelon, well supported. So states are kind of, until we get every bit of information related to how these are going to shake out as far as their category, we really can't implement those. So as Cammie stated earlier, this is not going to be a perfect system on October 2nd, but this is going to be it's going to be years building the body of services that states are going to be able to build under Title 4E. Let's talk about prevention plans, because in order for a child who is considered a foster care candidate to be eligible for the prevention services, there must be a prevention plan. And this is basically a case plan. These will not be court cases, these children, unless, and we'll get into that in a little bit, unless families do come before the court for intervention. So the prevention plan must clearly identify the prevention strategies that will keep the child in their home and out of foster care, and then list the services and how they will keep the child safe. So every prevention plan must have that detail in it. And as I stated earlier, the prevention plans for the pregnant and parenting youth basically detail how these services are going to help them keep that baby safe and make the teen a good parent. And now we're going to talk about residential restructuring.
So as the bill has a lot of different aspects to it, but the biggest two parts of the bill is the prevention services and then the restructuring of the residential care providers. When we are looking at 4 different types, and the one that we have the most information from the federal government is called the Qualified Residential Treatment Program. I'm going to go into more detail about that in a second. And then we have a new setting for specialized in providing parental, postpartum, and parenting support for youth. Federal government said, states, you all develop that. I mean, based on the name, it pretty much puts parameters as to who this serves, but as to the details, it's left up to the state. Then there are supervised settings for youth who have attained age 18 years or older and can learn to live independently. This is not just thinking of a child care facility, but scattered sites, and Laura's going to go into more detail about that. There's the setting providing high-quality residential care and supportive services to children and youth who have been or are at risk of becoming sex trafficking victims. When we read that, we said, well, we probably shouldn't identify children as at risk of becoming victims of sex trafficking, and we have since then termed this setting a setting for vulnerable youth. So if you hear vulnerable youth, what we mean is at risk of children who have been or are at risk of becoming sex trafficking victims. Again, Laura will go into more detail, but we need to think broadly about this. The federal government did not define this category further. And when we think about sex trafficking and who is at risk of sex trafficking, that encompasses almost all of our children in foster care, because the mere fact of being a foster care child puts you at higher risk of becoming a sex trafficking victim. Lastly, there is a setting, and this setting is actually for the parents. It's not for children. Children can go with their parents, but it is a licensed residential family-based treatment facility for adult substance use disorders. So think about these are the settings where parents go and they can take their children with them, get substance abuse treatment, and we will be able to get reimbursed for the room and board for the child. So that is a very interesting concept in that it actually has already gone into effect. So everything else that I listed goes into effect October 1st, 2019. Don't think you're going to be moving your kids around. Everyone who, wherever your child is, September 30th, 2019, will be grandfathered in, and they'll continue their placement just as they normally would. And then we will have these new placements set up October 1st. They're still the same facilities. We're working with those stakeholders, talking to them about how we're going to transition into these new categories, but all the facilities that you know and love will operate almost exactly as they have been. So the Qualified Residential Treatment Program. This is the step below a PRTF. And a PRTF is a psychiatric, residential treatment. Thank you. A psychiatric residential treatment program. And so these are children that probably have all of the signs of needing psychiatric treatment, but they don't qualify for a PRTF because they haven't said, I'm going to kill myself and here's how I'm going to do it. But you all know these kids. You stay up at night, you worry about them, you think they have a lot of problems. Something's going to happen if we don't do something about it. But they haven't made that overt act to put them in the PRTF. So this level is a really restricted level of care. It requires, because it's so restricted, the federal government says we need to make sure that this is in fact where this child needs to be. And so there are a lot of checks and balances put in place. And because of all of the requirements that the federal government have set forth, by not following those requirements, the state may not get reimbursed. So it's a high, there's a financial risk for administering these QRTPs. It requires an independent evaluator. It requires a 60-day court approval. It requires the facility to be accredited by a nationally known organization. And then it also requires aftercare. And we're going to go into more detail about each of those.
May I ask you a question right now?
Sure.
We don't have one of these facilities in the state of West Virginia at all right now, do we?
No, we don't, because they haven't existed. They've never existed before.
And I've got a child that arguably where he's placed out of state, that's where he's going to be come October 1.
So that's probably true. Yeah, I'm sure it is.
Am I shaking in my shoes yet?
What do you mean?
Am I going to have to worry about finding another placement for this child?
No. All children, where they are, September 30th, are where they are. And they'll continue to be there until they complete their treatment, just as they would in any other circumstance.
So are you promising me the state of West Virginia, even though they don't like it, is going to continue to pay that out-of-state fee?
Absolutely.
Thank you. I'm going to hold you to that.
Yeah. Just call the cabinet secretary, tell them, Cammie said, you all will pay that.
Just a quick question on that. Is she talking about a psychiatric?
That is some other reason.
I don't know I'm not sure what type of.
We do send children out.
I understand that. So my question is, she wants to know about specific state. So a lot of times, you know, the kids are sent to the psychiatric residential complex, but they're not fall into what you're talking about now. So can they move from a psychiatric to a non-psychiatric residential?
If it meets the criteria, if the child meets the criteria for a QRTP, then they could make that move.
We've got kids out of state right now.
Yes, we do. And we are working, there's a lot of different initiatives going on as we speak. In fact, through the House today, as trying to bring those children back. So, and Family First encourages that in developing the criteria that we're going to go over. So the QRTP demands that in order for a child to be placed there, and to receive reimbursement, there is a 30-day assessment by a qualified individual. So this qualified individual is someone who has the ability to make a decision outside of DHHR, outside of the placements, outside of the court system, and is an independent evaluator for this assessment. The independent evaluator, or the qualified individual, is assessing the strengths and needs of the children, and we're hoping that the federal government will approve our CANS assessment. I'm sure most of you are familiar with the Child and Adolescent Needs and Strength Assessment that we use regularly. We're hoping that that will be approved by the federal government. The qualified individual will need to determine whether or not that child needs to be at the QRTP, whether residential treatment is appropriate, if the child can be served from a foster home or within the family with services. If the child does need residential treatment, is the QRTP the most where the child needs to be? Is that the least restrictive placement for the child? And then, in addition to those factors, the assessment needs to determine long-term, short-term goals, and all while working with the family and permanency team to make that assessment. So that assessment has to be done either prior to placement or within 30 days of the placement. The assessment requires that the family and permanency team be incorporated into these decisions. And that family and permanency team is very similar to our MDT, except it is a little broader in that it requires that biological family members, relative and fictive kin of the child, as well as professionals who are a resource to the family, be included. Also, if the child is over the age of 14, the child needs to be included. So now we have the assessment, we have our family and permanency team together, and we're going to work on a case plan. That case plan has to document that reasonable and good faith efforts were made to identify the folks that should be in that permanency, that family and permanency team. Evidence that the meetings were held at a convenient time for the family and permanency team. If reunification is the goal, then parental input was considered. Evidence that the 30-day assessment was made in conjunction with family and permanency team. That what the placement preference of the team was, regardless of what the 30-day assessment stated. If they differ, why they differ. And then the recommendations. All of that then goes to the court. And within 60 days of placement, the court has to make the approval that that is in fact the best placement for the child. So the court must have the 30-day assessment, can't make this approval, can't approve this placement without that 30-day assessment. The court also has to know what the family and permanency team believed was appropriate. And work whether the needs of the child can be met, is the most effective and appropriate level of care, and in the least restrictive environment. And also determine that if the short-term and long-term goals that the qualified individual determined for the child are appropriate. So ultimately, the court then approves or disapproves the placement. We've been working with the court improvement program to determine whether or not this is going to actually require a full hearing, if it can be something that our judges can do when everyone agrees, if everyone's in agreement, can the judges do this through an agreed order? How is this going to work mechanically? I mean, that's, I think the bread and butter lawyers like, okay, just tell me what to do and I'll start checking things off the box. So there are a lot of missing pieces right now about how all these things will line up, but this isn't the last time you're going to hear about Family First, and we will continue to work on that. I'm going to let Laura talk about the other placements.
Could I ask a question first?
Sure.
Based on the timing that you have on here, potentially a child could be in placement for 90 days and then be determined that that wasn't a proper placement.
Would actually be 60 days.
Well, you said they have 30 days to do the assessment though, so they could be placed and then do assessment in days and then.
If I said that, I misspoke. So the 60 days court approval has to be done with 60 days of placement. 30 days, so that from the date of placement, you have 30 days to do the assessment, and then from the date of placement, the court has to approve the placement within 60 days.
But they could potentially be in the wrong place for 60 days before it's.
That
could be determined.
That could be determined, yes.
Is that going to cost the parents money or the state?
Would not cost the state money, or I'm sorry, the parents money, if it's determined. So let's say that the qualified individual, and I think most of the time when we place a child, there's been discussions beforehand, MDT's met, and a child's placed, especially with, I think, in QRTPs, that's going to be a decision that maybe the court's already involved in. You may have a situation where then the child's placed there, the 30-day assessment's done, the 30-day, the qualified individual says, actually, no, this is too much for this child, this is too high of a level of care, the child would be better placed at home with wraparound services. That all goes to the court, and the court says, I disagree. So in that situation, the court has every right to disagree, and the state would just not get reimbursement for that placement.
Well, what are we going to do when and I know you know what I'm talking about, we've got a facility that they can't get their act together to get that report back to you in 30 days.
So it's not up to the facility to do that assessment. That qualified individual is outside of the facility. It has to be an independent person, and regardless of how the person is paid, which we haven't exactly determined yet, ultimately it'll come from the state in some form or fashion, but regardless of that, that person has to be independent from the caseworker, from the MDT, from the facility.
I have one big concern on this, and my concern is that if the evaluator comes back and says that we have a better step-down option at the local level, are they really versed in how much we have at the local level? Or are they just looking at a piece of paper that says the model says these are the wraparound services that are available?
Their job is not to bed shop. Their job is to make a true determination of what that child needs.
Well, I understand that. The problem is if we have a situation where we place, and it is the least restrictive residential placement, but they say, oh, you'd be better to send them back and put them in locally.
And then
I bet you just answered my question. They don't know. And so the team and the judge are left with a situation where they're operating off of theory. We don't have those services. I'm in Huntington. I'm told we are service rich. We've got holes all over the place in our services.
So ultimately, it's the court's decision. So if we had a qualified individual who sort of has a pie in the sky, maybe has a pie in the sky of, oh, we can provide, this child doesn't need this high level of placement, we should do A, B, and C, and maybe the court has dealt with the situation for longer, has input from other folks, then the court makes the decision, and the court's decision rules the day.
So we've got a court that's going to be the watchdog over the independent person that comes in and analyzes it, who may be either saying yay or nay, depending on how his pockets get lined.
Well, that's why the qualified individual is independent and we have to attest that the child, well, you put it in quotation marks or not, I'm just telling you what we have to do.
As Cammie said, the judge can make the determination that the placement prevails. The state will not get 4E. That's why we put on the previous slide that this is a large financial risk for states to administer, because that can happen, and it probably will happen.
Oh yeah, it'll happen.
So I didn't mean to get snippy about that, but we are working through these problems, and we understand that there's a lot of concerns about them. But this is where the federal government has given us this guidance, and it's not our choice. It's what the federal government says you will do, and so we will do it.
Okay, and so now we will talk about the layers or the levels of, and I won't say levels because that's been a hot topic, that word is a buzzword. So what I will say is categories. So the next categories that I'm going to talk about are phrases that the federal government wrote about and did very, very minimal definition and said, states, you decide what this is. And so our high-quality residential programs for vulnerable youth are going to be programs that serve children up to age 21 who have been or are at risk of becoming sex trafficking victims. And so research tells us that there are a lot of factors that go into being at risk for sex trafficking. And some of you know this because you probably experienced it with the children on your caseloads. These are our runaways. These are our kids who have been abused or neglected. Homelessness. Homelessness is probably the #1 risk factor for children to enter the sex trade. Children who identify as LGBTQ. Children with no meaningful connections to their family or to their community, our state wards. Kids who have experienced significant trauma. Kids who experience unsafe sexual practices. And kids who, quite frankly, are involved with the foster care system. So research tells us that these things are factors. And so the federal government, through some of our conversations with our liaisons and with Jerry Milner, the federal government left this broad because they believe that this is a service that states can use to, do curriculum, to do types of prevention activities. I know West Virginia has, dealt with runaway issues before. And so this category is truly trying to stop that cycle of kids entering the sex trade. Supervised programs for youth living independently. These settings are for youth. The actual federal program instructions say that it's 18 to 21. But in West Virginia, we do have a good many youth who do independent living activities beginning at 17. So West Virginia is choosing to start this program just like we have for years and years. We're going to allow 17-year-old kids to enter this program. We won't be reimbursed through 4E, but we haven't ever been, so it's no different than how we've been operating. But this gives us a unique opportunity. And the purpose for this was to end our foster children graduating foster care into homelessness, into the prison system, into the sex trade. And so this will open up a level of service that is not necessarily in a place. So, for example, these kids can access an independent living coach if they're in college, if they're still staying with, if they go back home and they are going to stay with a family member. They can still get these services to assist them in, learning the ropes of adulthood. Yes?
How do the kids get into your program? They themselves, since they're adults, they're going to have to child with themselves.
Well, what would happen is, right now, today, if a child wants to access Chafee services, or wants to stay in foster care to finish a program, the court either has to order them to remain in custody, or they sign what's called an FC-18. Now, what this will allow us to do is to not necessarily make them sign that agreement. So if the child is willing, they have to be willing to receive the service.
From my experience, most of them do not want to sign themselves back.
Right. And here's what we also find is that at 18, they get 18-itis, and they don't want to sign themselves in. They don't want anything to do with us. They're going and they're going to conquer the world. But what we see are a lot of kids who come back within months or a year or two who do want to have that relationship, and they're sometimes met with varying degrees of receptiveness from the department. So what this service is going to look like is through contracts with our child serving agencies, the ones you know and love. We actually have a stakeholder group now. We're working diligently on, expanding what we currently do for kids to kind of look at this. So what our goal is, what would be a perfect world is for every child who turns 18 in foster care to be hooked up with an independence coach. So if they go back home, this independence coach will try to help navigate that, because so many kids do go home. If they decide to go to college, then these services could be delivered to them whether in their dorm room.
So they're going to contact the child who's been in foster care.
Well, I mean, that all hasn't been worked out yet. The referral process, we're still building it. We're building this airplane as we're flying it down the runway.
All these programs you talked about, are they all just programs we've already had in the state of West Virginia, which is now federally funded?
No, this is new. Right now, today, if you want to have services after you turn 18, you either have to sign yourself, we call it sign yourself into custody, but it really isn't custody, it's the agreement, or a judge has to order you in. And you would have to be in, or you had to stay in a facility. This isn't going to be that restrictive. So this is going to open up money so that kids don't have to sign the FC-18. But they still have to they still have to volunteer. We can't force them to take the service. Okay.
And all these programs still go through DHHR.
They will have to be a former foster child. And there's going to have to be somebody that maintains that case for that child in order to pay the bills. So even though the child may be hooked up with stepping stones in Huntington or in Wayne County, there's still going to have to be a provision for that funding, because we still have to pay the bill. So if your question is, will they still have to hang out with the DHHR? Yeah.
On those that we've gotten the subsidized adoption for, with the belief that they had the right to ask the department for the college benefits, are we still going to have that?
These children have to age out of the foster care system. So if they've been adopted, they would not be eligible for these services.
So are those services on the children we've already gotten adopted, they're going to lose?
I don't know that we're paying any Chafee funding right now for adopted children. Adopted children still get the subsidy.
Okay.
This doesn't change the subsidy for adoptive kids.
Okay.
Okay. All right. Let's talk a bit about the family-based treatment facilities that will be allowing. We already have these. We suspect that they are going to probably grow through some of the other needs that we have related to the opioid epidemic. But we have 4 agencies right now that we're working with through development of contracts. And some of you may know them. There's Renaissance that's run through Prestera in Huntington. There's FMRS Turning Point, I believe is the name of their program. Then there's Summit Center's Mom and Baby program. And a new one is being developed by Burlington UM Family Services. And I think it's called the Moms and Babies programs. I can't remember. They're not, I don't think they're brand new. So we are currently in the works to get this developed. We're working on some 4E workthroughs in our computer system, so this should be something that we see. These kids must be in foster care through a Chapter 49 petition. And the judge will then allow the physical custody to be with the parent, to be placed with a parent. And I think this happens already in pockets. I don't think it happens a lot because, quite frankly, there's not a lot of capacity for this program. Yes?
Well, speaking of that, where you're talking about pockets of areas, it appears that depending on what part of the state you live in, there's a big disparity about what's available.
Yes.
And does the state provide a database or where we can look to, if I'm going to go to an adjoining county, what services are available in that county?
These are programs that are operated through our Bureau for Behavioral Health Services, and I believe for substance abuse treatment programs they do. I don't have that, but I believe it's on their website where you could see some of their, are you talking about like residential facilities?
And even the services that through what you're providing or the state's providing as far as even who's available to do the counseling, who is someone who's certified. Do you have a place you can go to and find?
Usually those things go through our 211 or our family resource networks in the communities. The department does not have an exhaustive list. We have tried to wrap our arms around that several times, but because we have so many we have 4 bureaus that each operate and fund multiple different services. So this has been a project that's been kind of ongoing through the Secretary's office. But
yeah, it seems very confusing to
it
me
is.
as GAL that you're making recommendations for services that you can't say definitively whether they are existing currently or not,
Yeah.
or whether the state will pay for it.
Yes, it's been a huge problem, not necessarily about knowing where services are, but because, certain areas, you may not have the workforce or the capacity for agencies to go into every community and, put up shop. And so what we have is just pockets of brilliance, like Bob said earlier about Huntington is just like the service capital of the state, but he probably sees a lot of shortcomings even within Huntington. So I know exactly what you're talking about, and the department has acknowledged that and is trying to, do more uniformity, because it's great to have a fabulous wraparound service, in Charleston, Huntington, and Morgantown, but if you don't have it in Pocahontas County, I know. Now the programs that serve the adults for substance abuse, in order to get that 4E maintenance payment, they have to provide the parent with parenting skills, individual counseling, family counseling, and of course the substance abuse treatment services. And Ms. Chapman, will wrap us up?
So we went through all of that, and I think everyone, I've sat through many CLDs and thought, okay, how does this affect me and my work? And when I think of the guardian ad litem and the role that you all have to be an advocate for the children, that's really where this comes into play, and becoming knowledgeable about the services that will be in your area. And again, it's frustrating because we don't have every service in every corner of West Virginia, but to be knowledgeable about that, to advocate for that, to advocate for taking the risk of keeping children at home with services, that's a scary thought. I know many of you will struggle with that, and when is it appropriate? Some of these cases for the prevention services won't have an open court case, but some will, because the children can be removed and then placed back into the home with prevention services, or in youth service cases, they could easily be a candidate for these services as through a youth service case. So advocating for prevention services, keeping the child in the home, knowing too that services, just because of being your role in the community, learning about the services that never hit CPS, so the Bureau for the Bureau for Medical Services is developing an SED waiver, and this will be for children who have that serious emotional disturbance. They can receive services like wraparound and other type of services without ever being walking into the office of the department. I mentioned that the children's wraparound program that exists. There's pilots projects that's being expanded statewide. Again, that's a little different than Safe at Home because it doesn't require a court case. It can be done without a court case. So there is an initiative across the bureaus to work with these children in order to prevent removal and prevent those cases. And this begins October 1st, 2019. This is the first time we've talked to you, this group of folks about it. We will be talking to you all about it come next year, and we will be talking about it the following year. So don't think that this is the last time you're going to hear about it. Don't think that it's going to be magic and that everything's perfect. It will be a process, and we are hopeful and encouraging that you all will be part of the process and work with us on this. So, any additional questions?
You mentioned youth service clients can qualify, but they still have to be in foster care through their youth service case. Correct?
Youth service cases could qualify for prevention services so long as they are a candidate under the definition of candidacy that we talked about.
But they wouldn't be in the QRTP or anything unless they were in foster care.
So I was referring back to, in case you all can't hear, she was asking whether or not youth service children would, could be a part of these programs. So not only could they be a part of prevention services, because they, if a status offense petition is filed against a youth service case, they're automatically going to be a candidate for foster care, because in most, well, unless they're removed from the home, but if they're still in the home and petition is filed, they're most likely a candidate for foster care, and because they're at imminent risk of removal, and therefore the prevention services would be available to them. In addition to that, if they have been removed and a foster family isn't appropriate, they could be a part of any of the residential treatment centers under the 4 that we just talked about.
May I ask you a more generalized DHHR question?
Okay.
Right. Be sure. Whenever you all let APS Healthcare grab the purse strings and run this like an HMO, and we had a deficit, there were decisions like ending child-oriented activity all at once without any preparation. Now that we have a surplus, are there any talks about maybe restoring this to a child-focused enterprise as opposed to an HMO-run organization?
That is not in my wheelhouse, so I'm going to pass on that question.
Okay.
Any other questions?
So this Family First, this is the rules that say that when our kids are in foster care, we don't have to get permission to get haircuts, and we don't have to get permission to spend the night at a friend's house. And
That's not Family First. There is a federal statute that talks about the reasonable prudent parent standard. It's already been in place. It's been in place for years, and if you're hearing about that in the legislation that's going through now, there's been a push to make sure that our rules are updated, and a lot of myths are dealt with, because there's a lot of myths out there about what we can approve and what we can't approve. And so that's one of the goals of that legislation.
okay, so we have that in place in West Virginia now, right? I mean, so we don't have to go. Our kids can go spend the night with a friend, and we don't have to go get a court order to do that. Correct?
Our policies are written in such that it encourages that, but you often deal with just jurisdictional areas. So if you come upon a situation, then you may want to call a supervisor or find that foster care policy and remind people.
Okay.
Because that whole risk and liability was hard for some jurisdictions to up, like, oh gosh, I don't have to fingerprint everybody, and they kind of flip out about it. So, I mean, yes, it has been in place for several years, but as with anything, it takes a while to really saturate into the community.
Thank you.
It's just that, like, we're privatizing all these services and they get paid for by some federal fund now. I'm just not understanding this.
Okay, let me try to help.
Traditionally, 4E has only paid for foster care placements.
4E is
4E, maybe that's what we need to do. Let's back up a little bit. Title 4E is the largest federal funding stream for Child Protective Services. We have Title 4E and then we have 4B. And so your question earlier about the socially necessary services, that has traditionally been funded through 4B, and that's only like $5 or $7 million that we get, and so we supplement that with state dollars. So we're not talking about 4B today. We're talking about 4E, which has traditionally only paid for foster care placements. So with Family First, what the federal government has done is said, you know what? We think it's probably a good idea to start funding in-home stuff too.
So is it like the Safe at Home program?
Well, you'd think so. Hold on with me, let me take you on a little ride. For about 25 years, the federal government has run what's called Title 4E demonstration projects. And so what they did is that states would sign this contract with the federal government saying, I want to use my 4E dollars creatively. And so they said, okay. And so they've been doing these projects for about 25 years in an effort to gain information and research to give to Congress that says, look at the beautiful things that states can do when they use their 4E funds creatively. And so what happened is that they put a deadline on those 4E projects to end in 2019. And so West Virginia hopped on the 4E demonstration project back in 2014, which has funded Safe at Home. So this is 4E money that's been like, all the rules were put on hold so that we could just use it to do lots of really good stuff, and we really have. So what happened is that Family First got developed like back in 2016 as a way to kind of further the 4E projects. But it didn't quite go far enough because it really restricted that creativity. With Safe at Home, we use that money to do things that are not behavioral health. They're not mental health services, they're not substance abuse services, and they're not in-home parenting. We pay for kids to do recreations. We pay for a lot of things that Family First is not going to pay for. So the Title 4E projects will end on October 1st of 19. And so that is why we're doing a lot of the things Cammie said, all this like, searching for the SED waiver, because we want to further. It's serious emotional disturbance. It's a way that Medicaid can use. It's kind of like the Title 4E waiver that we have, but it's what Medicaid can do to say, we want to be creative with our money. And so the feds will say, yes, that's a lovely idea. And so they're working on that process right now to help us sustain Safe at Home because those Title 4E projects are going to end.
Okay, so let me make sure I understand.
Okay.
The money used to come from 4E just for foster care and that's all. Now it's going to come and pay for all the services that West Virginia created.
No, it's only going to pay for in your slide, 4E is only going to pay for those 12 services. And we're not even sure 100% that those are the ones they're going to pay for. They're studying this right now. But it's going to grow over time so that at maybe 5 years from now, there's like 400 services on that clearinghouse that we can choose from. But we're still going to be using that 4B money to fund socially necessary services. That's going to keep on trucking, so don't worry about that. It's just that this is getting a little more creative, but it's not going to be as creative as the Title 4E projects. And if you have any other questions, just call my number back there, and we can philosophize about 4E much longer if you'd like.
Does it have anything to do with the House bill that's being submitted to privatize foster care?
No.
Can you repeat her question? Can you repeat what you just said?
She asked if the House bill, the 2010, is related to this, and that's a completely different initiative. Nothing to do with Family First. Yes, sir.
Is is this meant to replace funding for foster care now? Or is
No. That's a really good question. I'm glad you asked it. No. There's just, what they're doing is that foster care funding for family care and residential, as long as you meet those categories that we talked about, that's going to keep on too. But it's just opening up this new thing that they're putting their toe in creativity. They're like, we want to try it, but we're going to just stick a little toe in first. Yeah.
I was just wondering if you could maybe address House Bill 2010 a little bit, because I think some of us are very confused about whether it's something that we would like to support or encourage or discourage. And I find it very confusing to try to understand how this would play out and how our jobs would change or how CHHR would change.
I don't think that this is the forum that we can do that. And if you would want to contact the sponsors of the bill, it's not a bill that DHHR it's not what we call an agency bill. So it was there were a number of different sponsors in the House. I think you would be better off contacting the sponsors to understand their vision of what the goals of that bill would be.
What are the estimates about how this affects your budget? Is this intended by the federal government to reduce 4E funding to the states? And if so, by what percentage?
We don't have that information. That may be a goal of the federal government. Probably the federal government is always looking for ways to reduce funding to the states, but that has not been stated overtly, and there's not any discussion about reducing.
So are they they're going to continue to reimburse the state for traditional foster care placements?
That's correct.
And are they going to continue to reimburse the state for grandparent or kinship placements?
All that stays the same, just as it does today.
So we're going to need, based on this, we're going to have some new findings in our orders, right? So not only are we going to have to be trying to achieve permanency and meeting reasonable efforts, but what I get from some of these libraries, we'll have to have a finding that, I can't remember. But are you guys going to be sending us a checklist?
Yes, we are working with the Court Improvement Program to figure out that checklist and to get it out. Thank you. Well, I really appreciate you all having us today. Enjoy your seminar and try to stay warm. Thank you.